So guys, when you have lengthy questions like this, always remember you have to start reading from the last line first, because that gives you the crux of the question. So the question is, which of the following nerves is most likely damaged in this patient? That is what I read, and then I see the options, and I see the options are somewhere related to lower limb. So now I know that they are asking something for nerve injury in the lower limb somewhere. So let me have a look at the findings. So when the last line you have read, and then you read the second last line, sensation over the rest of the foot is normal, right? Then you read the line before that. So actually the lengthy question, you start reading the reverse. That is actually time saving. Sensation to pinprick is decreased between the great and the second toes of the right foot. Now, is this a giveaway in the question? Without reading the rest of the question, just based on this line, can I answer this question? Yes, because in the foot, the gap here between the great toe and the second toe, the sensation here, this is very, very important question which comes as a one-liner. What nerve supplies here the first web space? First web space, it is deep peroneal nerve. This is just a one-liner frequently asked fact in all the exams, including FMGE exam, which has been put in a confusing question like this. So this is the deep peroneal nerve, and based on this itself, the answer becomes deep peroneal nerve. You should never forget that. This first web space, the sensation is deep peroneal nerve. What dermatome is this? Can someone tell me? What dermatome is that? The first web space of the foot? Next time, if they do not ask you the nerve, they ask you the dermatome, then what is that? Aragni, the test is there in the medsynapse app, test series section on the home page. There you have this F3 with N3. There you will find the test, and the rest of the test also will be uploaded there in the app. Every Friday, the morning, the test will be uploaded. Chalo, tell me what dermatome is it, which is the first web space? Yes. Is it L4? Is it L5? Is it L3? Is it S1? Is it S2? Please remember this is L5. Okay, important. This is L5 dermatome. Okay, this is L5 dermatome. This is also important. Now, the next question that I have for you is, which nerve causes dorsiflexion? The peroneal nerve or the tibial nerve? Which nerve in the leg causes dorsiflexion? The peroneal nerve or the tibial nerve? What is the mnemonic for that? You remember the mnemonic for that is ped tip. What is ped tip? Peroneal nerve causes eversion and dorsiflexion. Tibial nerve causes inversion and plantar flexion. Okay, inversion and plantar flexion. The exception here is inversion is done by tibial muscles, that is tibialis anterior, tibialis posterior. Out of that, the tibialis anterior is supplied by the deep peroneal nerve. Okay, deep peroneal nerve. So this is a very savior mnemonic that comes to your rescue. Remember ped tip. So what do you expect in this question when the deep peroneal nerve is gone? Ped tip. So it is the peroneal dorsiflexion. So the dorsiflexion should be affected. That is what is given here. Weakness of the ankle dorsiflexor muscles. Okay, weakness of the ankle dorsiflexor muscles. The everter muscles have full power. Eversion is by the superficial peroneal nerve, the everters which are there. Okay, so remember the answer here is going to be deep peroneal nerve, and the patient has the foot drop as well because the dorsiflexion is affected. Foot drop, generally the question you get is common peroneal nerve, fracture neck of fibula, one of your last year NEET PG exam question as well. Common peroneal nerve which is injured by the fracture neck of fibula, that will cause foot drop. Okay, that will cause foot drop. Clear with everyone? Right? So the answer here is deep peroneal nerve. Okay, the answer here is deep peroneal nerve. It is not common peroneal. It is not superficial peroneal because the everters are not affected. The lateral compartment of the leg is not affected. It's the anterior compartment, the deep peroneal nerve, which is affected. Okay, right, great. Yes, deep peroneal nerve is the anterior tibial nerve because it goes in the anterior compartment.